For years, the people of London have trusted their leaders, believing that the safety of their children was paramount. Yet behind closed doors, troubling reports accumulated, detailing patterns of exploitation that went unaddressed. The mayor, a figurehead responsible for the capital, publicly insisted that there was no evidence of organized predatory groups operating in the city, while official reports told a different story, highlighting repeated instances of abuse that were documented yet seemingly ignored. Whistleblowers within law enforcement and social services grew increasingly concerned, noting similarities between the documented cases in London and previously exposed scandals in other parts of the country, where authorities had failed to act, allowing vulnerable children to suffer. Over nearly a decade, inspections conducted by the National Oversight Body produced reports analyzing the performance of the police and fire services, including assessments of how well they protected children from sexual exploitation. And within these reports, case studies revealed specific instances where minors were coerced, drugged, threatened, and assaulted, painting a picture of a systematic problem. The mayor responded publicly to these reports, addressing administrative failures and praising law enforcement for progress in some areas, yet never once acknowledged the incidents of child exploitation detailed in the case studies, leaving a glaring gap between public statements and documented reality. When journalists from NationLine UK began investigating these discrepancies, they uncovered not only the reports themselves, but also communications showing that city leadership had read, understood, and chosen to dismiss the evidence, raising serious questions about accountability and transparency. The police commissioner, confronted by the growing media attention, publicly reversed the long-standing position that there were no active investigations into multi-perpetrator exploitation cases in the city, acknowledging that a steady stream of such cases existed and that a significant number required reinvestigation following national reviews, a revelation that exposed years of underreporting and institutional inertia. Experts in child protection and former officers who had previously exposed similar scandals described the London findings as a continuation of the same pattern they had witnessed elsewhere, emphasizing how cultural sensitivities, political caution, and the desire to protect reputations had consistently overridden the imperative to safeguard children, resulting in preventable suffering. Activists and campaigners for victims' rights highlighted that children affected by these failures experienced lifelong trauma, while perpetrators often remained free, emboldened by systemic neglect, and that unless decisive action was taken, the cycle of abuse would continue. Critics of city leadership argued that public denials of the evidence constituted more than administrative oversight. They suggested an active facilitation of a cover-up, noting that the political and social cost of confronting the issue had repeatedly been prioritized over child welfare. Independent inquiries and investigations in other regions demonstrated how authorities had repeatedly failed to act due to misplaced fears of being labeled discriminatory, showing that political considerations often outweighed moral and legal responsibilities, and that such failures were not merely historical, but present-day concerns that demanded urgent attention. Journalists, using freedom of information requests and access to official documents, pieced together a timeline of ignored warnings, each report containing detailed accounts of victims, circumstances of coercion, and the identities of suspected offenders. Yet these records were met with silence or deflection from those in power, creating a climate in which abuse could persist unchecked. Social service professionals who had witnessed the aftermath of exploitation emphasized the human cost. Children manipulated into compliance, families devastated, and communities left grappling with the consequences of systemic failure. When confronted with the evidence, public statements from city leadership minimized the scope of the problem, portraying incidents as isolated and overstating progress, while investigative findings suggested the opposite, a widespread, persistent, and inadequately addressed crisis. Policy analysts observed that repeated institutional failures contributed to a lack of trust in authorities, with citizens questioning whether reports of abuse would ever be taken seriously and whether the mechanisms in place to protect children were effectively enforced or merely performative. Legal experts weighed in, noting that deliberate ignorance of evidence, particularly when communicated to leadership, could constitute a breach of duty and potentially criminal negligence. further intensifying calls for accountability and scrutiny. Advocacy groups called for independent oversight, urging the establishment of an inquiry that could operate without political interference, ensuring that victims' voices were heard, perpetrators were brought to justice, and preventative measures were implemented to avoid repetition of past mistakes. The scale of the uncovered reports suggested that the problem was not isolated to one area of London or one demographic, but rather spanned multiple boroughs and affected children from diverse backgrounds, reflecting the complexity of the issue and the necessity of coordinated responses between law enforcement, social services, educational institutions, and community organizations. Victims and their families, often silenced by fear and shame, were given a platform through investigative journalism, highlighting the profound emotional and psychological impact of the abuse, while also emphasizing the resilience of those who survived and the urgent need for societal acknowledgement of their suffering. Analysts warned that institutional culture within the police and municipal offices, characterized by risk aversion, hierarchical decision-making, and an emphasis on reputation management, had contributed significantly to delayed or absent interventions, illustrating how organizational behavior can exacerbate societal vulnerabilities. Ethical commentators stressed the moral imperative of confronting uncomfortable truths, arguing that political expediency should never outweigh the protection of children, and that systemic reforms must include transparency, accountability, and mechanisms for whistleblowers to report concerns without fear of retaliation. The investigative findings prompted public debate about the role of leadership, governance, and civic responsibility, with calls for structural reforms aimed at ensuring that oversight bodies had sufficient independence and authority to act decisively in the face of evidence, rather than allowing bureaucratic inertia to dictate outcomes. Mental health professionals highlighted the intergenerational impact of exploitation, noting that unaddressed trauma could lead to long-term psychological distress, difficulties in forming trust-based relationships, and increased vulnerability to further exploitation, underscoring the societal cost of inaction. Civic groups, educators, and local councils debated how best to integrate preventative education, community support, and early intervention strategies into existing frameworks, emphasizing the importance of equipping young people with awareness and resources to report abuse safely and confidently. The scale and depth of the report suggested a failure not only of individual actors, but of systemic structures, including communication channels between agencies, record-keeping practices, and response protocols, all of which require comprehensive review to prevent recurrence. Investigative journalists emphasized the necessity of continued oversight, encouraging media outlets to maintain pressure on authorities, ensuring that lessons learned from past failures were not forgotten, and that accountability measures were enacted swiftly and transparently. As public scrutiny intensified, pressure mounted on political leaders to explain why critical evidence had been ignored or dismissed, prompting debates in legislative assemblies and public forums about ethical governance, transparency, and the social contract between officials and the communities they serve. Former investigators and whistleblowers offered insight into how similar patterns of denial and obfuscation had historically allowed abuse networks to thrive, stressing that institutional memory and documentation often provide clues to systemic weaknesses that must be addressed proactively. Data analysts highlighted trends within the reports, identifying recurring indicators of exploitation, geographic clustering, and operational tactics used by offenders, which could inform predictive models for law enforcement and social services, aiding in early detection and intervention. Public opinion surveys reflected growing dissatisfaction with city leadership and law enforcement, revealing that citizens increasingly expected rigorous oversight, prompt action on reported cases, and full transparency regarding ongoing investigations, framing a societal demand for reform. Ethical reviews recommended the creation of independent review panels with statutory authority to audit investigative processes, evaluate responses to reported abuse, and recommend policy changes based on evidence, ensuring that institutional learning was codified and sustained. Youth advocacy organizations emphasized the need for empowering young people to participate in safety planning, awareness campaigns, and reporting mechanisms, cultivating a culture of vigilance and support that could counteract the risks posed by predatory groups and systemic neglect. Law enforcement training programs were called into question, with recommendations to enhance awareness of grooming patterns, multi-agency collaboration, and cultural competency, ensuring that officers could recognize, document, and respond effectively to exploitation while maintaining sensitivity to diverse communities. Legal reforms were discussed, focusing on closing loopholes that had allowed perpetrators to evade justice, strengthening protections for whistleblowers, and clarifying responsibilities for senior officials who receive credible reports of abuse but fail to act, reinforcing the principle that accountability must extend to the highest levels. The narratives of survivors were central to advocacy efforts, highlighting personal experiences of coercion, manipulation, and betrayal, while emphasizing the resilience and courage of individuals who came forward despite societal stigma, underscoring the human dimension behind statistical analyses. Investigations revealed that coordination failures between different agencies, police, social services, healthcare, and education, contributed to gaps in protection, allowing offenders to exploit procedural weaknesses and the lack of real-time communication, demonstrating the critical need for integrated response systems. Policymakers debated strategies to embed continuous improvement processes into organizational practices, including regular audits, mandatory reporting requirements, scenario-based training, and community engagement, aiming to institutionalize vigilance against exploitation. Technology solutions were also explored, with secure reporting platforms, data analytics, and interagency databases proposed to enhance the ability to detect patterns, identify high-risk cases, and coordinate interventions efficiently, bridging historical gaps in information sharing. Cultural commentators discussed the societal implications of ignoring evidence of abuse, noting how failure to act not only harms immediate victims but erodes public trust, normalizes inaction, and implicitly condones neglect, creating an environment in which offenders feel emboldened. Media ethicists stressed the responsibility of journalism to shine a light on hidden injustices, highlighting the delicate balance between reporting on sensitive matters and safeguarding victims' privacy, while ensuring that public discourse remains informed and constructive. Across communities, engagement initiatives sought to educate families, children, and local stakeholders on recognizing signs of grooming, understanding rights, and accessing support, fostering resilience at the grassroots level to complement institutional safeguards. The investigative revelations prompted reflection within political circles on the importance of evidence-based decision-making, the perils of ignoring warning signs, and the ethical obligation of leaders to prioritize human welfare over optics or popularity, emphasizing leadership accountability. Psychological analyses examined the methods used by offenders to manipulate and control victims, demonstrating the sophistication of coercion tactics and reinforcing the necessity of multi-layered protective measures, including counseling, mentoring, and consistent oversight. Community leaders advocated for restorative practices alongside punitive measures, seeking to heal affected individuals and neighborhoods while dismantling the conditions that allowed exploitation to persist, illustrating a holistic approach to justice. Ongoing scrutiny by NationLine UK ensured that public attention remained focused on accountability, policy reform, and survivor support, creating pressure for systemic change and the reinforcement of ethical governance principles across municipal and law enforcement structures. Educational authorities integrated safeguarding modules into curricula aimed at empowering children with knowledge about personal boundaries, reporting procedures, and resilience strategies, highlighting the importance of preventative education in tandem with enforcement measures. Researchers continued to analyze the data from reports and investigations, identifying trends, high-risk indicators, and potential policy interventions, feeding into a broader strategy to anticipate and mitigate exploitation risks proactively rather than reactively. Legislative bodies debated new frameworks for transparency and oversight, including mandatory publication of investigative outcomes, regular independent audits, and strengthened whistleblower protections, ensuring that institutional accountability was not left to discretionary enforcement alone. Survivor advocacy groups coordinated networks to provide legal, emotional and social support, while also participating in policy consultations, ensuring that reforms were informed by lived experience and grounded in practical understanding of the challenges faced by victims. Public campaigns reinforced awareness, calling on citizens to report suspected exploitation, engage with safeguarding services, and hold authorities accountable, cultivating a culture of collective vigilance and responsibility. Ethical guidelines for media coverage were developed, balancing the imperative to inform with the need to prevent secondary victimization, emphasizing accuracy, sensitivity, and integrity in reporting. Multi-agency task forces were proposed to address ongoing exploitation risks, integrating police, social services, healthcare providers, educators, and community organizations, aiming for coordinated, timely, and effective intervention. Research emphasized the importance of early detection, timely reporting, and continuous monitoring of high-risk environments, underscoring the value of proactive rather than reactive strategies. Cultural and community-based initiatives sought to build trust, encourage reporting, and reduce stigma associated with victimhood, recognizing the critical role of social support in preventing and addressing exploitation. The cumulative effect of these measures, investigative journalism, policy reform, survivor advocacy, community engagement, and legal oversight, aim to transform systemic weaknesses into robust, protective frameworks capable of reducing harm and holding perpetrators accountable. In the shadow of previously ignored warnings, these coordinated efforts represented an unprecedented opportunity to confront historical negligence, restore public confidence, and ensure that children's safety is elevated above bureaucratic inertia or political convenience. Yet, the urgency remains, for the evidence has been uncovered, the cover-up exposed, and the public demands action, sustained, transparent, and accountable. The city's leaders, law enforcement agencies, and oversight bodies are now under scrutiny, and the next steps they take will determine whether justice is served. Systemic failures are addressed and the next generation is shielded from harm, or whether history will repeat itself, leaving victims to bear the consequences of inaction. The narrative is clear. The time for denial has passed. The need for accountability is immediate. And the moral imperative to protect children cannot be deferred. As the eyes of the city, the nation, and the world watch closely, expecting leadership, transparency, and justice,